Hey nurses, welcome back to Howdy Nurse, your go-to channel for practical, no-nonsense nursing education. Today we are talking about something critical in ICU care, ventilator alarms. Let's break it down simply so that you can stay sharp and respond fast. Section 1. Why ventilator alarms matter. Ventilator alarms are life-saving alerts. They tell us when something's wrong, whether it's with patient, the tubing, or the ventilator itself. The golden rule: never ignore an alarm ever. Section 2. What is ventilator alarm? A ventilator alarm is an automatic alert from a mechanical ventilator. It's triggered when it detects abnormal pressure, volume, or breathing patterns. It's like the ventilator saying, "Hey nurse, check this out." Section 3. Types of alarms. There are 4 main types of alarm you will run into: high pressure alarm, low pressure alarm, apnea alarm, low tidal volume alarm. Let's go through each fast and clear. Number 1. High pressure alarm. Think blockage like secretions, kinked tubing, biting, or bronchospasm. Actions: suction the patient, reposition the tube, or give bronchodilators. Number 2. Low pressure alarm. Causes: usually a disconnect or leak. Actions: reconnect the tube and check the whole circuit. Number 3. Apnea alarm. Causes: the patient has stopped breathing, maybe due to sedation or fatigue. Actions: check them immediately, start manual ventilation, and notify the doctor. Number 4. Low tidal volume alarm. Causes: could be an air leak or patient fatigue. Actions: check all tubing, assess the patient's effort, and adjust settings if needed. Section 5. The dope mnemonic. Need to troubleshoot fast? Use DOPE. D is for displacement of tube, O for obstruction like mucus or kinks, P for pneumothorax, E for equipment failure. Easy to remember, fast to apply. Section 6. Do and don'ts. Do's: always stay calm, always assess the patient first, always have an ambu bag handy. Don'ts: never ignore or silence an alarm without checking. Don't assume it's a machine error. Don't delay. Seconds matter. Section 7. Summary. Ventilator alarms are not just beeps. They are crucial, life-saving tools. Know the causes, act fast, and always use DOPE if you are unsure. Remember, you are the patient's first line of defense.